Hey, what's up? Energy Physio, wrapping up the ultimate guide to sports medicine. And what we're going to do is kind of take all the stuff from the last several videos, kind of tie it all together in one guide for injury to return to sport. Right? So we've seen some flaws in our current model, which is this idea that when pain's gone, a slow return to sport is okay. There are a lot of gaps to fill there, and so we're going to try and fill those in with some basic information that gives you a really clear pathway on what to do when you're injured or have pain, what that means, and how do we get back to some strengthening and conditioning in a way that lets us return to sport with no problems. All right, so we're going to break this into two pieces. We're going to talk about the I3 model first, then we'll jump over to the L3 model second. And what the I3 model is, this is our rehab model, right? So if you're dealing with something, this doesn't have to be formal rehab. There's plenty of information out there to let you take a crack at this on your own. And so we're not even talking about formal rehab here. We're just talking about taking yourself from a state of pain or injury to a state of no pain and better movement, right? Because this is what needs to happen before we can even think about returning to sport. So we're going to say we're starting somewhere in this box. An injury is different than incident. So a lot of people think like if they have pain, they're injured, but that's not necessarily true because they function totally normally with pain. They just have pain while they do it. So injury, this is life change, right? You can't do your normal day. You can't do your normal work. You can't do any of your normal things because maybe you've broken a bone or had surgery or torn a ligament, something like that. This is as sinister as it gets. Like you're coming back from something that has put a serious dent in your lifestyle. Right? Versus pain, the incidence level, this is something that you might be managing or dealing with, but you're still pretty much doing all the things you want to be doing to some degree. And so this is where we're starting, right? And our goal is to go from bottom left of this chart over here to the top right at return to sport. We're going to work our way there over the next couple videos, right? So here we are. You got pain, you got injury. Inevitably, if you're here, we need to get you to here. Up to this incidence level. And once you're here, now our goal is to get up to this top level of incomplete mechanics. And what this is primarily dealing with is mobility and your movement, right? So if you've got mobility restrictions, that's going to affect the way you move. And most of the time when we're dealing with pain or even injury that's occurred from movement problems, so like non-traumatic stuff, this would be like non-traumatic ACL tear, that comes from a mobility and a movement problem, right? So we're always tracing orthopedic pain back to incomplete mechanics. Where are joint restrictions, where are muscle restrictions, and how is that affecting the way we move? Because when the body moves into positions that are less optimum, it has a higher chance of developing pain, strain, or injury, right? So the idea here is, hey, you've gone to rehab or you've got some rehab to do on your own, because you've got some pain or you've been injured. What do you need to do? You need to figure out where are your mobility restrictions, and what should your movement look like, and how does your movement compare to that, right? So if you've got ankle joint restrictions, hip mobility and movement restrictions, those are big problems for the knee. And in rehab, we always need to be looking above and below the pain site. So like the knee is never the knee's fault, it's the hip and the ankle's fault. The low back is the low back's fault. It's the T-spine and the pelvis's fault. So there's always a lot of factors that we need to be tying in. But the idea for rehab is that we need to be wholeheartedly pursuing resolution of incomplete mechanics. Because it is not until we have better mobility and better movement that we should ever start thinking about loading these things with strength and conditioning. And Greg Cook does a really good job talking about this with functional movement systems, is we should never load a dysfunctional pattern. And that's what incomplete mechanics is. It's dysfunctional patterns. If you have joint restrictions, you're going to have a dysfunctional movement pattern. Even if you don't have mobility problems, you can still have movement that is not as it should be. And so when we're talking about rehab, the sole purpose of rehab should be to resolve mobility problems and movement problems. You should be able to move well through basic functional movement by the time you're done with rehab. And if that is the case, like we've resolved a lot of mobility problems, we've got your movement looking pretty good, now we think it is safe to shift over into a more strength and conditioning type model. We should never load on top of mobility problems and movement problems. We should always resolve those things first, and now we're shifting over into this, hey, we're moving pretty good, our mobility is pretty good, we can start to load this. And as we load, we're going to see that through this L3 model that it can actually help us further highlight movement and mobility problems. So now we're not only shifting from the model into strength and conditioning, but it's incorporating into that more of a prehab type situation where we're continuously monitoring our movement and mobility and challenge that in a way that highlights our restrictions so we can resolve those on our own. Right? So our movement, we should always be kind of internally understanding, hey, this is what my movement feels like. I need to do this joint mobilization or this tissue mobilization and then get my movement to look better in this position. And so in doing this, we're not only rehabbing the problem, but now we're starting to create this prehab model through strength and conditioning and understanding what our movement should look like. So having said that, we're going to take a little pause there, move into the L3 model. See you later.